my good friend, and always look forward to his weekly visits with us from Akron Children's Hospital, Dr. Joe Congeni on board with us this morning. Joe, good morning. Thanks for making time for me again.
Hey, Ray. How you doing this morning?
I'm doing very well. What do you have for us?
Good. I want to talk to you about, sometimes we go through these and cycle back, and there are different injuries that we haven't talked about in a while. I don't think I've talked about this one in a long time, and there's a unique injury that occurs in young athletes, and it's really confusing to parents. So I kind of want to talk about it again right now, and especially in light of a new recruitment that we've had down at Children's that I want to talk to you about. But there's a condition that only really younger athletes get, and when they play sport a lot, there is kind of a bump on the bone or the growth plate of young athletes. It's very unlike anything that you'd get as an adult. Starts out as a bump, and it becomes kind of a chuck hole in the bone. Kind of a chuck hole like our roads in February, and they can be the size of a pea, a marble, a dime size. And when they get to that point, they get loose in the joint, often in the knee, and they will swell and they lock up, and kids cannot run at all. They can't move the knee. This is a more significant condition, and it's one of the few things that when they get loose and they get to be rather large chuck holes, they often need surgery. So you've heard us say that, boy, in young athletes, pretty typically there aren't too many things that need to be operated on. But this condition, now hold your hat for me for a second here, is called osteochondritis dissecans. It's called OCD.
Okay.
And so a real long name thing. It occurs in the knee, but guess where our pitchers get this? In what part of the body do you think they might get this chuck hole?
I don't know. Lower back? I don't know.
They get it in their elbow.
Oh.
So from throwing a lot, they get this locking up of the elbow or dead arm in the elbow, and we get an X-ray. You don't even need an MRI because it's in the bone and the growth plate. You'll see these chuck holes. How about our gymnasts and dancers? Where do you think they get it with all that bouncing and springing and jumping? They get it in their ankle, and the ankle swells. And if you're seeing adult athletes, it's a very mistaken for torn cartilage, because in adults this would be, or even our college athletes and stuff, you'd say, oh my gosh, the knee's locked up and swollen, it must be torn cartilage. But in young kids between the ages of about 8 and 18, we'll get a look and you'll see this dent or chuck hole or loose piece that goes on in the joint that often needs surgery. And during the pandemic period of time, we actually were in the middle of recruiting one of the nation's experts in pediatric sports surgery from Dallas, and he agreed and came here, and he actually started this week, August 1st. He is one of the best known surgeons in the country for this condition called OCD. His name is John Pawlowski, and he had trained at the Cleveland Clinic, went to Dallas Children's, but really liked Northeast Ohio, and he moved back and just started with us this week. He's really a star in this position, so you know how I am. These are all part of our team, and to add somebody like that to our team, we're really, really excited this week. And John's claim to fame is he's one of the best-known people in the country at fixing these little chuck holes known as osteochondritis dissecans. And so we really want to welcome him to the area, and his kids are starting school here this week, and he got going in our area. But this OCD already in several of our pitchers this summer and in several other, I had a knee in a football player this week that will swell, and it happens in the ankle as well. And it's not an unknown condition, and it's one of the few things where young athletes need surgery to get it fixed.
Dr. Joe Congeni, Akron Children's Hospital, with us here on 93.5, 1590 WAKR. Joe, hold on with me a minute. I got to get traffic and weather out. I want to come back to you. I have a couple of questions for you. Joe, you saw the Big Ten canceled their fall sports. Akron Public Schools pushing sports back to October. As a sports medicine doctor, how do you look at all these chips falling one way or another?
again, I touched on it a little last week, and that's why I didn't want to get into too much of that. We're talking about this every week, but I'm always looking at it from the standpoint of the athletes. They're in my office. You know how much I like young people getting to deal with these teenagers and adolescents, and the importance of the sport to them, the time they put in, the emotional input that they have to the sport, how much they care, and just to see how much work, how much time, how long they've been at it, and see that it comes down to this, and see that the last couple months and weeks and months and even day to day has been such a grind on these young athletes. Are we going to play? Are we not? Now we've been in about 6 weeks, and the kids have done really pretty well locally in the progressive program that they've been in trying to get ready and condition so that they can have a season, and then they get to the end of the line and may well be told, hey, we're not going to have sports at all. It hurts. It's hard. You look them in the eyes, and there's a lot of uncertainty. And so instead of knowing, hey, if I work hard, I can do well, I can reach my dreams, all my dreams are in front of me now. Oh, a lot of the kids in the office are, hey, my dreams may be taken away. But the kids are also pretty mature about it, too. They know we're in a time that is very, very unique, like nothing else, in our lifetime. And nobody really knows the answers of what will be going on with this pandemic and virus a month from now, 3 months from now. So every time we put a date out there and we say, okay, well, let's just play October 1st. Or maybe we're going to play January 1st, or maybe we're going to play spring sports. But they know there's still uncertainty about any of those dates coming to pass. And so I think I'd have to tell you that it just hurts to see that these kids love their sport. They learn so many great life lessons from sport. Sport's been so good for so many kids, just like a lot of other extra curriculars are at school. People that are in plays and dance and art, they gain so many other things outside the classroom from that. And just this uncertainty about whether they're going to be able to be back in their comfort zone and do the things they want to do and start chasing their dreams again. It's been kind of tough to see these kids, especially because it seems to be changing almost day to day, Ray. And we're getting near the end of the road now for fall. And I don't think it looks too good. And what happened yesterday probably points to the fact a lot of people are not going to be able to play sport this year.
Yeah, great. 10 minutes in front of 9. Joe, as always, thanks for making time with me, my friend. Catch up with you again next week.
Okay, Ray. Have a great week. Thank you.
You too. Dr. Joe Congini, real good one. Akron Children's Hospital. Love his insight. He's been with us for over 20 years.